Good afternoon, ladies and gentlemen. My name is Nirav Shah. I'm the director of the State of Maine Center for Disease Control. I'm joined today with Commissioner Pender Makin, the Commissioner of Maine's Department of Education. And Commissioner Makin and I are here to provide everyone an update on the COVID-19 situation across the state. Overall, the Maine CDC is now reporting 1,603 cases of COVID-19 statewide, which represents an increase of 38 cases since yesterday. Of those 1,603 cases, 1,437 are laboratory confirmed and 166 are probable cases. Overall, 211 individuals have been hospitalized and 35 individuals are currently in the hospital. Of those 35, 16 are in the intensive care unit and 19 are in non-intensive care unit beds. And as of today, 8 individuals across the state are on ventilators. Sadly, as we've discussed, there have been 69 individuals who have passed away with COVID-19 and 993 who have recovered thus far. Of our 1,603 cases, 354 have been among healthcare workers. And thus far, Maine CDC epidemiologists, medical staff, and clinicians have fielded 6,686 requests for consultation. I want to just touch on a couple of other areas. The first is an update on our laboratory. As Governor Mills noted and announced, we have recently entered into a partnership with IDEX in order to greatly expand our state laboratory's ability and capacity to conduct testing. Since announcing that partnership, the Maine CDC laboratory has been undertaking the necessary scientific steps that are required in order to bring that testing fully online. That project is going as scheduled, and we project that by Monday, just in a couple of days from now, Maine CDC's laboratory will be online with the new testing materials and reagents provided by our colleagues over at IDEX. I'll have much more to discuss on that topic on Monday, as well as the implications of that expanded capacity for our overall strategy and approach to testing statewide. I'd also like to touch on a topic that we talked about yesterday, which is concerns that were raised by a journal article published by some researchers about the Abbott ID Now device. As it turns out, in addition to that news yesterday, the US FDA itself issued a document that also raised some concerns about that device. We at the Maine CDC, since we began distributing those devices across the state, have noted some of those early pieces of data and have continued to keep physicians up to date on some of those concerns that are out there about the accuracy. I want to be really clear about that. What we know about the test's performance so far is that if it returns a positive result, we can have high confidence in that. You can take a positive result to the bank. But a negative result, the science is still out on how to best interpret that from a clinical perspective, as well as from a public health perspective. That's why Maine CDC has continued to communicate with physicians and healthcare providers that if they believe that a particular individual strongly has all the signs and symptoms of COVID-19, if their clinical suspicion for COVID is high, if they run that patient sample on the Abbott device and it comes back negative, they should look upon that with a question mark. They should immediately treat that patient as if they were COVID positive by providing them the necessary public health guidance to stay in isolation and avoid contact with others. We've also asked Maine clinicians to send us a nasal swab sample so that we can run a confirmatory test. That's been happening. As it turns out, just earlier I was on a call with some clinic operators who have indicated that they've done just that. And thankfully, in many situations, the negative result was confirmed by Maine CDC's laboratory. But there's still more science that's being done. And as that science is underway, we're going to keep those protocols in place so that we don't accidentally let somebody who might have the disease walk out the door. I'd also like to provide now an update on some of our overall public health preparedness activities. The first thing I'd like to update everyone on is some more news around the distribution of a drug called remdesivir. Earlier this week, I talked about the fact that Maine CDC had received from the federal government a shipment of 10 cases of remdesivir, which we immediately turned around and distributed to hospitals. Earlier this morning, Maine CDC received notice again from the US government that we would be receiving an additional 7 cases of remdesivir today. A few hours later, a few hours ago, we did receive those 7 cases, and they are currently in transport to hospitals across the state right now. Overall, these 7 cases can be expected to treat approximately 35 patients across the state. Remdesivir is a drug that has been studied in other applications before, and there are some early data that have been conducted by the National Institute of Health, which suggests that it can shorten the number of days that someone who's seriously ill needs to be in the hospital for. There's a lot of clinical study going on right now about the overall effectiveness of the drug and other ways that it can be used. But what we want everyone to know is that we are working very closely and in partnership with hospitals and healthcare providers across Maine, such that when we receive shipments of the drug, we're able to push it out immediately so that doctors and other healthcare providers in Maine have yet another tool in their belt that they can use to provide the best care for patients who are in the hospital with COVID-19. We're not sure yet about how much more remdesivir, if any, the state of Maine will continue to receive. We know that the federal government is working very, very hard with the manufacturer of the drug to continue to secure more supplies. And as we learn more from our colleagues and counterparts at the federal level, we'll keep everyone up to date. But for today, the 7 cases that we've received are on their way out and should be arriving at hospitals across the state of Maine as we speak today. In addition, our colleagues at the National Guard have continued their exemplary work on getting as many healthcare providers across the state fit tested so they can make use of N95 masks. Just yesterday, the team at the Guard fit tested 78 healthcare workers, and today, on May 15th, they are fit testing an additional 130 staff members at locations across the state, from Portland all the way across the state, from north to south. By thus far, 738 individuals, healthcare workers, have gone through fit testing training by our colleagues at the National Guard, but their mission is not yet over. They still have an additional 500 individual healthcare workers that they intend to fit test in the coming days and weeks. We again thank our colleagues, the men and women at the National Guard, for joining up with us to fit test as many healthcare workers as possible. We've been continuing our distribution of personal protective equipment across the state as well. By the end of today, Maine CDC will have fulfilled nearly 1,700 orders for personal protective equipment to healthcare providers, local fire, rescue, and EMS groups across the state. We still have many more orders to fill as those orders come in, and this is what our public health emergency preparedness team does on a daily basis. We intend to continue that operation to make sure that frontline emergency and healthcare workers have the PPE that they need in order to stay safe and continue to provide healthcare to each and every person in Maine. Next, I'd like to provide an update on the various vital medical assets across the state. The first is the total number of intensive care unit beds, which stand at 357, 156 of which are available. In terms of ventilators, there are 307 ventilators across the state, 248 of which are available, and there remain available 420 alternative ventilators. Finally, an update on the outbreak front. I would like to note that there have been 2 outbreaks that have been where we have gone, again, more than 1 incubation period without any new cases. These are both in Port Resources facilities. We'll have more information about those over the weekend or perhaps a bit later today. This is information that just came in, but there have now been 2 additional facility level outbreaks where they have gone more than 1 incubation period without recording any new cases. Maine CDC is also now classifying an outbreak at the Durgon Pines facility. Just a few hours ago, we were made aware of now 3 confirmed cases at that facility. Our team of epidemiologists is touching base with that facility to make sure that they have all the public health guidance they need. That comes on top of the facility also receiving shipments of PPE. Just in the past several weeks, the facility has received approximately 330 N95 masks and about 1,450 surgical masks. But any response to an outbreak involves first and foremost making sure we're providing quick, adequate care for the patients in that facility, and then providing epidemiological, clinical, and PPE-related advice to the facility. Our teams of epidemiologists and medical officers will continue that discussion as we learn more about the dynamics at that facility. And as we do, we'll have more updates for everyone. So I'd like to turn things over to Commissioner Makin now. Commissioner?
Thank you very much. I'm pleased this morning or this afternoon to share with you that the Maine Department of Education has secured internet connectivity for nearly 22,000 Maine students who previously had no way to connect with their schools, their education program, and their teachers. This effort has been a combined one featuring input from teachers, parents, students, and school leaders, our partners at Connect Maine, and our partners at the Department of Administrative and Financial Systems. Through this combined effort, we've been able to identify how many students actually haven't had connection because of the lack of broadband or because of the lack of resources at home to tap into a broadband that might be available. We, prior to the pandemic happening, we identified the lack of connectivity in Maine homes as being a very concerning inequity. And as a result of the recent pandemic, that has come into a full-blown crisis for so many kids. We've had teachers who've been struggling to connect with their students, family members who have felt fairly alone in trying to provide education remotely without that human connection to what's happening with the class, the peers, and the educators. And now, 100% of those students having reported through their schools a lack of connectivity have been connected through this effort. And we just wanted to share that this has been a primary priority for the department and for all of our partners who have supported the work.
Great.
Thank you.
Thank you, Commissioner. We will now turn things over to our colleagues over in the media. And today's first question is from Patty White over at Maine Public.
Hi, can you hear me?
Yeah, sure can, Patty. Go ahead.
Great. I've got a question both for you and Commissioner Makin, but I'll start with you, Dr. Shah. So you said that you expect to start using the IDEX test on Monday. Can you tell us where things stand with the staffing needs that go along with ramped-up testing, from additional lab staff to contact tracers? And I know that yesterday you mentioned that we've got 30 contact tracers, but in the past you've said we probably need to boost that even higher to 60.
Great. Thank you for those questions, Patty. So Patty asks about our overall staffing levels. First at the lab. You're right, Patty. One of the pieces that was absolutely vital in being able to expand our laboratory testing capacity from about 2,000 per week, where it was before, to now over about 7,000, was not just having more equipment, not just having more reagents, but having team members who could help out with that, both from a laboratory testing perspective as well as from a data entry and an analytic perspective. So our team at the lab has actually been interviewing folks all week, and I believe we have hired now 4 additional administrative staff members to help out with the data entry and data analytics, and it's what's called accessioning, the process of taking samples in, and the reporting, the process of reporting those results back out. And so interviews have been going on all week. I believe it's 4 additional staff members who have been brought onto the team. And of course, they are, again, vital to the overall effort of expanding our overall throughput. Now, on contact tracers, the plan there, Patty, is a stepwise one. What we're doing is continuing to hire up more and more individuals who can work on contact tracing as the number of cases rise. So our overall goal, depending on where the outbreak may peak, is to hire up to approximately 110 individuals. We've been revising those based on what we see as the need to make sure we're adequately caring and contact tracing each and every individual across the state. That process is not one that will be a light switch that we flip. It's going to be a dial that we continue to turn up as the outbreak and the complexion of it changes. If case numbers dwindle, then we may be able to turn the dial back down. But I want to say one really important thing, Patty, about contact tracing. We talk a lot about contact tracing, but I think sometimes we may not appreciate that for many groups across the state of Maine, receiving a call from the Maine CDC is not something that they may be used to. In fact, I think for most folks across the state, getting a phone call from someone who says they're from a state agency and wants to talk about the fact that they might have been exposed to a disease that they may have only heard about on the news can be jarring. We fully recognize that. But more than that, Patty, we recognize that for certain portions of our community, that phone call may not just be psychologically jarring, it may be something where the communication itself just can't happen and needs to happen via an interpreter, a translator, or a cultural broker. I've had the opportunity to have conversations with members of the New Mainers communities and other immigrant communities across the state, including one just earlier today. And they've made very clear to me that we're not there yet. And we have more work to do in order to ensure that our contact tracing adequately meets the needs in a culturally respectful way of these populations for whom any kind of call from a government agency in and of itself is jarring, but we need to make sure that we're able to do so in a way where we're communicating in a culturally sensitive and appropriate manner. The members of those communities, I thank them for bringing these needs front and center to me, and we have heard them, and we're making sure that as we go through this process, we fully integrate their concerns and make sure they are at the table with us, being a part of that contact tracing effort, not separate and apart from it. So thanks for that question, Patty.
Thanks. Can I ask a question of Commissioner Makin?
Oh, yes, I'm so sorry. My apologies. Please.
No worries. Thank you. Commissioner Makin, can you tell me how long the state is planning to provide these new devices and internet connection for students, and how that affects reopening in the fall? Does having those devices make it less urgent for schools to open their doors?
So the question is, how long will the devices and the connectivity services be available to students, and does that have an impact on whether or not schools will be opening their doors in the fall? Thank you very much for that question. And I guess the answer is that we have purchased ahead of time 6 months worth of connectivity, cellular data service, in most cases for students who needed the connectivity. Those sometimes come with a MiFi device or with a tablet, and those are permanently going to be with the families, the students, through the schools making that provision. Going forward, we're hoping to be able to support schools and hoping that schools will have time to support through their school budget processes ongoing connectivity for those students in the event that we're unable to be fully back full-time with everybody in person. Our hope, of course, is to have every single child and all of our teachers back in a safe, healthy environment at school. That is our number one priority. We're working very hard with a group of student cabinet members, with family members, and with our partners in all of the realm of school leaders and educators. And we're working to create plans that would allow us to be ready to go back in person, to also perhaps be ready to go back partly in person with some people who might be in high-risk groups, being at home and also receiving a robust and meaningful educational experience. We're also preparing for the event that might not happen, and we're preparing for a fourth scenario whereby we go back to school and something else happens with this extremely unpredictable virus, and we end up in an emergency out-of-school situation again. All of those scenarios are being looked at by our school safety center, by a team of school nurses, by experts and specialists in the field, and by our partners here at the CDC. And we're going to make the best decisions we can.
Great. Thank you, Commissioner. And sorry about that, Patty. Didn't mean to cut you off earlier.
Dr. Shah?
Yep.
I hate to ask this, but is there any possibility that somebody is not muted and they're banging away on a keyboard so loudly I can't hear a thing?
Okay.
Can I ask that person to mute their phone?
Yes, by all means.
*6.
Okay. So if there's someone who's not on mute, if you could please mute yourself by hitting *6, and when you're up in queue, by hitting *6 again to unmute. So thank you. We'll see how it goes, and then keep me posted. We're not able to hear that background noise here, so thank you for letting me know about that. We're going to go next to Kate Koff over at the Ellsworth American.
Thank you, Dr. Shah. So both of my questions are for you, and they're related. So correct me if I'm wrong, but my understanding is that the state is sort of buying PPE, in bulk and then distributing it to these organizations that need it. I am wondering, can you tell us if the organizations that get that PPE are going to, or maybe they already are, fully reimburse the state for the cost of it? And then if that's not the case, are they going to be returning it to the stockpile? And are they billing the patients for the use of that or for the PPE?
Okay, great. And then let me just write those down so I don't forget. So Kate asks about what happens after PPE is distributed. As everyone has heard me talk about, we have pushed out hundreds of thousands of pieces of PPE to healthcare providers across the state, principally to congregate care settings like nursing homes, as well as to first responders like locally based fire, rescue, and EMS. So Kate, your first question is whether they reimburse the state, whether there is a charge for that PPE from the state. The answer is no. The PPE is pushed out to them. It's part of what we do at the Maine CDC, working in concert with our colleagues at the National Guard and the Department of Transportation. This is what we do in emergency situations. There's no bills, there's no reimbursement. You ask then if the PPE is unused, whether it's returned to the stockpile. And the answer there is no, mainly for the same reason as, if you go to the pharmacy and you pick up a prescription and it turns out you decide not to use that particular medication, the pharmacy won't take it back. And it's sort of similar with PPE. Once it's been pushed out, we have to make sure that anyone who receives it knows that it hasn't gone through an additional set of hands. So once it's pushed out, if it's not used, then it does not get returned to the stockpile. Now, what we have found, especially in large-scale pandemics, like the one that we're in now, is that there's not a lot of excess PPE that's sitting in hospital or firehouses across the state. Just the opposite. A lot of our deliveries are making sure that facilities can keep going. We're not aware of any reports of large-scale stockpiling of PPE. And then finally, you ask of whether the facilities are allowed to bill for it. And the way that the system is set up, the answer is no. Facilities are not allowed to bill the federal healthcare programs for any of the PPE that they receive from Maine CDC. That is a service that is provided, and they're not allowed to submit any bills for it. Thanks for that question. We will turn now over to Amy Brown over at WERU.
Thank you, Dr. Shah. First question I want to ask on behalf of someone who sent this question to everybody on this call, I think. which is, what is the level of daily testing required to safely reopen for tourism with social distancing?
Sure. So Amy asks about the level of testing that could be required for any situation, specifically tourism. And Amy, you know, the answer there is that the science is still out on that question. Because the pandemic globally is just a few months old, there hasn't been a lot of analysis around the exact number of tests that might need to be conducted in order for there to be, you know, a zero chance that there could be an outbreak related to tourism. What we know, though, is based on some other countries that have experienced COVID-19 before the United States, is that in general, a level of testing that allows states, jurisdictions to get to a roughly 2% overall positivity level means that there is a wide enough net that's being cast so that anybody out there, whether they are a full-time resident or an occasional tourist, an occasional visitor, can have access to it. The positivity rate in that respect is a proxy for the overall amount of access that's available. That's why one of our goals is to try to get our overall positivity level down to about 2%. In concert with that, we also know that probably more testing overall capacity will be needed. And so that's why we've been working with hospitals as well as private commercial laboratories to help them get the technical assistance they need to ramp up their testing as much as possible. The third variable is how much testing would an occasional visitor to the state of Maine really need? Meaning a lot of folks who may come here, if they're only here for a day or two, would they actually be tested in the state versus going back home? Those are the type of questions that we're working with our colleagues at DECD to try to get a better handle on, because it will help us as we're planning for any potential ramp up over the summer.
Thank you. And a follow-up, if I may. What kind of numbers are you looking at, and which numbers are you looking at to determine when and if it will be safe to allow tourists to come back into the state while practicing social distancing and wearing face coverings without the 2-week quarantine? Is there any metric that you would see that would predict within this summer that would be safe enough?
Yep. So Amy asks about what type of numbers and metrics that we are looking at specifically as it relates to tourism. And Amy, the answer is, in addition to the 6 standard gating criteria that we've talked about, we actually just updated our numbers there on our website just yesterday with the latest figures on where Maine stands with our gating criteria. And those data are available on our website. The other variable that we have to look at is what might be happening in other states. So as we think about reopening within the state of Maine, the gating criteria that we've talked about, as well as this positivity rate, those are the things that we think about as it relates to the internal reopening of Maine. But as we look at external reopening, tourism in particular, but other forms of places in which visitors may be coming, it's important for us to continue looking at the overall prevalence of the disease in neighboring states, as well as the other states in which we know that visitors come from Maine. Well, we've started taking a look at those data, again, in partnership with our colleagues at DECD. And what we found is not surprising to folks who are listening and watching the news every day, which is that virtually every state around Maine, in fact, every state within the Northeast, has a higher prevalence of disease of COVID-19 than the state of Maine. New Hampshire and Vermont, even though Vermont has half the number of people, they have about the same number of cases. New Hampshire has about the same number of people and significantly more cases, to say nothing of, for example, Massachusetts, which is now well over 80,000 cases as compared to our 1,600 cases. So, Amy, in addition to the gating criteria that we look at internally, we're also now looking at the dynamics of the disease in other states, because those are the places that visitors would be coming in from. So we've got to take a sense of what the disease looks like there and how that affects how we would think about anybody, higher numbers of people coming in, and what the likelihood is that they may bring the disease with them. It's a very difficult balance, and it's one we're pretty actively involved in right now. I'm going to turn now over to Terry Stackhouse at WMTW. Terry, are you with us this afternoon? All right, we're going to come back to Terry in just a second because we will turn to Brian Sullivan at WABI.
Thank you, Dr. Shah. I have a question for you and for Commissioner Makin. I also would like to point out that I was not the unmuted typist earlier on this call.
Understood.
Can you give us an update on the first shipment of remdesivir and how it's working? And you mentioned that there's enough for 35 patients I believe the original shipment was for 50. Just give us a little information as to, is this going to the same people who it was going to before, and how it is working with the patients it was given to? You
got it, Brian. And I think we've got some intel on who the mystery typist was, but we're going to keep that under wraps for now. The first shipment of remdesivir, Brian, was enough for approximately 50 individual patients. And then you're correct, this most recent shipment that's going out as we are speaking is enough for about 35 patients. The way in which we distributed it was we took a look at where the critically ill patients in the state of Maine are, literally where the patients are in critical care units. And we distributed the drug according to the percentage of the number we looked at the hospitals in which there were critically ill patients, and we distributed the drug according to what percentage of the overall number of critically ill patients in Maine were in specific hospitals. That's what we did for the first dose. That's what we're doing for this most recent shipment as well. In terms of how it's been used, I actually have a call tomorrow morning with healthcare providers across the state to check in with them about what they've been seeing with the drug, how they are using it, and what feedback they've got for Maine CDC in terms of how we can do better, how we can try to advocate for additional shipments of drugs. So I hope to have a better sense of that on that call tomorrow, Brian. What I can tell you is that in speaking with my counterparts across the other 49 states who have themselves been distributing the drug, we've heard that providers overall, actually, I've heard from providers in Maine, I should say, that we're thrilled to have this drug as part of their armamentarium. And we heard that from a number of hospitals and providers. But I think you're asking really, Brian, about the outcomes that they've seen. And for that, I'm hoping to get a better sense from our clinical colleagues tomorrow. But rest assured, we've received very positive feedback on the fact that the drug is here in Maine. But in terms of the outcomes that I think you're inquiring about, we're hoping to have a better sense tomorrow. And you had a question for Commissioner Makin?
Yeah, Commissioner, I was wondering if you could give us a little information about what you'll be saying to Maine school systems about when this school year will end, if any guidance will be coming from your department, or it's going to be all under local control and decision-making.
So the question is about when the end of the school year that we're presently in will come, and that is indeed under the control of local school boards. However, our understanding is that most schools are following their calendar to the end of their school year, and others may make different decisions based on the waivers in terms of numbers of school days, because that has sort of been convoluted with ability that we have to provide educational experiences for students. So I do believe most are following their school calendars.
Great. Thank you, Commissioner. We're going to turn back to Terry over at WMTW. Terry, are you on?
Yes, Dr. Shah, can you hear me?
You sure can. Go ahead.
Great, thank you. The Department of Labor issued guidance in April for coronavirus prevention at construction sites, which recommend social distancing and the wearing of face masks. Our news outlet has observed at several sites that we've just passed by that this is not necessarily always being adhered to. Is there a message from the CDC or the state to contractors in terms of protecting the health of construction workers, particularly in light of the multiple cases we now know of the virus at the site of the planned Maine Veterans Home Facility in Augusta?
Sure. So Terry asks about specific advice for contractors and construction workers to keep safe from coronavirus. And Terry, what I will say there is that we've talked about this as it turns out, and I think my advice is twofold. The first is by all means, please, for all of you guys and men and women who are watching, who work in construction sites or who are contractors yourselves, those pieces of advice to utilize PPE, please, as much as you can in all circumstances, please adhere to them, as well as the social distancing guidance. We recognize that at a construction site, it may be difficult to do so. There's no question about that. But even though a lot of folks, I think, feel that though they may be outside and there's a lower risk for coronavirus transmission, which there may be, nationwide, there have still been outbreaks associated with outdoor activity. We also know that in many construction sites, individuals who may be working there may also, for example, live with one another. They may socialize with one another. And so even though the construction site may not have been the actual location of transmission, it could be that individuals are living in close proximity, are socializing with one another after work. Again, it's a reminder, as always, that to the extent that physical distancing can be practiced, that's one of the best tools we have right now to reduce the likelihood of anyone transmitting or getting infected with the virus. So thanks for that question, Terry. And we're going to turn now.
Dr. Shah, I have a follow-up question, if you wouldn't mind.
Sure.
In this particular case, there were some out-of-state workers who were working on that site alongside Maine workers, two of which tested positive. We know that there is the 14-day quarantine requirement for non-essential travelers once they come into Maine. My question is, what benefit does that 2-week quarantine have if folks who are essential workers are able to travel into the state and then possibly transmit the illness?
Sure. So Terry asks about an investigation that's currently underway. And Terry, I just, right now, the investigation is just that. It's underway. I think there was an assumption in your question that hasn't been demonstrated yet, which is that the outbreak came in from the outside. The investigation is still underway. So we're not sure where the outbreak may have initiated and who may have given it to whom yet. That's one of the things that our field epidemiology team is looking at right now. But it's also a good reminder, again, that if individuals are coming in from other states, even for essential work, it may not have been the work site that was the mode of or the place of transmission, but it could have been the fact that they were rooming with one another or socializing with one another. But right now, Terry, our investigation is just getting underway. Our epidemiologists are just in the process of interviewing folks. And right now, we're not sure what the mode of transmission was and where it may have originated and who may have transmitted it to whom. As we learn more, we'll have more updates. I'm going to turn now to Lindsay Mills over at News Center.
My question today is for Commissioner Makin. Separate from the U.S. CDC guidelines for schools that were released recently, which critics say are not very detailed, is the Department of Education working on guidelines for schools separate from the U.S. CDC?
So thank you for the question. It is with respect to, are we using simply the CDC guidelines, the national CDC guidelines, as we consider how best and how to safely reintegrate students into a classroom-based learning situations? And the answer is no. We are using a number of diverse sources. We are using a lovely report that's quite comprehensive put out by Johns Hopkins. We have models and research from European schools who have already started down the road of reintegrating students. We're using everything that our local CDC, who we trust very well, and with our stakeholders who work in schools, including school nurses who know both health, medical science, and the logistics of running a school. We're working with a number of sources as we keep, first and foremost, the health and safety of our students when we consider how we're going to transition back.
Great. Thank you, Lindsay. Next up is Brad Rogers over at GME.
Thanks, Dr. Shah. I have a question for each of you. First, Dr. Shah, could you just go over, exactly what you know about the outbreak at the construction site at the Maine Veterans Home, the numbers, and anything else you know about it?
Okay, so Brad's question for me is around the outbreak at a construction site right now. Again, Brad, we are just now starting our investigation. We understand that there are at least 2 individuals who have been tested positive. So we're not even sure at this stage if it is an outbreak, because we have to find that epidemiological link among all of them. And then if it were to be an outbreak, then the next question is that transmission. How did it start? From whom? Who may have been exposed? And what other individuals do we need to be in touch with in order to give them advice on how to stay safe and look out for symptoms? So that investigation, Brad, is just getting underway. I believe my epidemiology team is having a call at 3 o'clock to start going into the details with the individuals who are affected and impacted. We will certainly have more information, but right now we're in the midst of getting the investigation off the ground.
Okay, thanks. And Commissioner Makin, what will the pandemic have to look like in August for you to think it's safe for students to return to school in the fall? And also, do you think it's safe for some schools to have graduation, say in August, early August?
So we have 2 questions here, I think, related first to what would be the conditions that would let us know it's safe to begin to return to the classroom-based learning, and also how are people handling graduations in the time of a pandemic. With respect to your first question, nobody globally, frankly, has identified what those specific public health markers would be, exactly what level of whether testing or whether decreases in cases. We're exploring all of those, and we're working with our colleagues across the nation. All of the other commissioners and chiefs of education are seeking that same type of information. None of us are ready to go this alone, and so we're taking it very seriously, and we're taking it day by day. This is such a dynamic situation. What we also know is that when those conditions do present themselves and when we begin that transition back, we are creating a very thorough list of safeguards and supports that will be in place for our students and their families and our educators and school leaders. And with respect to graduations, I know that so many of our 2020 graduates are feeling disappointed and feeling as though this spring would have been this joyful, traditional experience. And like 3.8 million other graduating seniors nationwide, they're looking at something very different here in Maine and across the nation. What we have been working on as a department, we've been reaching out to national media and have been working with our colleagues in other states. And I think I'm very excited to say that on Saturday evening at 8 o'clock on most networks, you'd be able to see a tribute and celebration to the United States graduating class of 2020, who will share a common experience unlike any other in our history. And we are there with them, we're there with their families. It's a very difficult time, and schools are making extremely careful choices about how to celebrate locally.
Great, thank you so much. We will go now to Joe Lawler over at the Press Herald.
Yes, hello. Thanks for taking our questions. So my first question is about the checklists that were released today for campgrounds and lodging, and they start out by saying, as the prevalence of COVID-19 begins to decrease, and we know that that's not true at this time. So do you think that should be changed? And then my second question is just more about remdesivir, and I know that the science is still being studied, but do you think it has potential for patients who are not hospitalized or in not as severe critical condition as what the drug is being used for now?
Okay, so Joe, great questions. I'm going to take them in reverse order. First on remdesivir. Joe asks first whether there's the potential for the drug to be used in non-hospitalized patients. The answer right now, Joe, is no, and that's because it has to be administered via IV. There have been discussions at a scientific level about whether the drug could be converted into a pill form, but that's where those discussions are, which is to say at the discussion level. But then you ask a really interesting question, Joe, about the possibility of using remdesivir in less critically ill patients. So this has been really interesting. The answer is yes, and this is just a testament to how quickly things are moving. When we got our first shipment last week, Monday, gosh, a couple days ago, the advice from the federal government was that this is a drug that is really intended for, and the science showed that for critically ill patients, this was something that had a benefit in reducing the number of hospitalizations. And then on a call, not even 48 hours ago, one of the experts around the drug noted that they had been looking at some data from another country. I don't even know if those data have been published, but in this new study that was being done, or this series, they had this other group of clinicians had started using it in patients who were not critically ill, rather in regular hospital beds. And the drug equally showed some possibility of promise there. So, Joe, you may have noted that when I've talked about the number of patients that the shipment can be used for, I've said approximately 35 patients, approximately 50 patients. The reason for that is that because of this new data that have just come out very recently and have been signed off on by the US FDA, clinicians have the option of using the drug on a 10-day course for very critically ill patients, and now, in addition to that, for a 5-day course for less critically ill patients. The big question right now that my colleagues from the other 50 states and I debated just 48 hours ago was, which is the better strategy? Should the drug be used in the most critically ill patients, or should it be used in less ill patients? It's a very challenging question. That's where the conversation is right now, Joe, and that's kind of what's going on. You all then asked about the checklists. Fair question, good point. We will run that over to DECD and Commissioner Johnson for their take on that. Next is Sarah Craighead-Dedman from the Machias Valley News Observer.
Oh, thank you, Dr. Shah. My question's for you. In late April, the Maine Freedom of Information Coalition wrote asking the CDC to reconsider releasing data that shows the exact or relatively exact geographic location of positive COVID-19 cases, maybe by town or zip code. And you've addressed that question in earlier calls. But now that Maine's beginning to reopen and some people are feeling more confident to move around, has your thinking on offering that data changed? And if not, why?
So Sarah asks about the way that we think about data and releasing it. And the bottom line there, Sarah, is that the thinking has continued, the conversation has continued, but our view really hasn't changed as of yet. The concern, of course, is the possibility for identifying potential people who may have been affected by COVID-19, particularly among communities where that identification could have serious implications for them. And that's a concern I take very seriously. It's one that actually just several hours ago on a call we discussed with various members of stakeholder groups across the state, and there was some reticence on that front. And I think it's also important to note that in addition to our position, the ACLU of Maine has endorsed and supported our view that we should be extremely cautious with respect to releasing additional potentially identifiable data. That being said, the conversation hasn't stopped. The conversation is ongoing. What we're looking at is ways that we can provide more granularity without compromising privacy. Even in the time of a pandemic, privacy still matters. We don't cede our privacy rights just because there's a disease going on. So we're looking for ways that we can balance those two things. The public's need to know what's going on with our obligation to protect privacy even during these challenging times. What I find reassuring from an epidemiological perspective is that the town by town, or as has been requested, zip code by zip code data, from a disease risk perspective, should not change the way in which you go about your life every day. My advice remains the same. I ask everyone, especially in counties where community transmission has been detected, to continue going about their day as if the virus were all around them. And when they're interacting with elderly individuals or individuals who are medically vulnerable, to act as if they themselves might have the virus and could potentially pass it on. That's the mental shortcut that I use to try to make sure I keep enough physical distance. The virus is here. It is in our communities. And even if we had data on a zip code by zip code level and released it, I would be afraid that it might give folks a false sense of security. They may say, well, it's not in my zip code, so I'm fine. But in any outbreak, we're only seeing a part of what's actually going on. And I would want to make sure that we gave everyone enough education around making sure they knew that even if their zip code weren't on the board, the virus is already likely there. I'm going to turn next to Steve Betts over at the Courier-Gazette.
Yes, thank you, Dr. Shah. Knox County has reported 2 more cases. So has that reached a level of community transmission? And could you explain maybe briefly again what that means?
Sure. Steve asks about community transmission and our criteria for how we determine when something has reached community transmission. Steve, the criteria are twofold. The first is that there has to be a minimum number of cases. And then we also require that our epidemiologists determine that at least 25% of the cases that have been detected do not have any known link with another case. That is to say, at least a quarter of the cases have to be in a situation where we can't identify a spouse or a classmate or a coworker or travel to an affected area. As far as we can tell, the person got the case by just walking around. Those are the 2 criteria that we use in order to determine when a county has reached the community transmission threshold. As of right now, Steve, Knox County hasn't entered that list, but there still have been cases in Knox County. And so again, even though we haven't put that label on Knox County, I still want everyone who's watching right now in Knox County to please go about your day as if the virus were already there, because we know it is. It is there. It just hasn't reached that threshold of being community transmission, but it could do so any day. And when we think about viruses and transmission, it's important to note that what we're seeing here today, the numbers that I report today, are at best a blurry Polaroid picture of a fast-moving train from 2 weeks ago. So even though right now there might not be community transmission, the numbers that I'm providing are what was going on 2 weeks ago from the virus's viewpoint. That may have changed. So for everyone in Knox County and the other 12 counties in total, please go about your day as if community transmission were already occurring. And the last question for today goes to TJ Tremble over at ABC 7.
Thank you, sir. When you were speaking about the reopening and looking at the prevalence of the disease in the neighboring states, has there been any internal discussion among your groups that meet for this about including the feasibility of setting up testing sites on heavily traveled entry roads to the state?
So TJ asks about the possibility of expanding the availability of testing on heavily trafficked entryways into the state. And the answer, TJ, to your question is yes. We've discussed that extensively with our stakeholders, with the groups that we work with, as well as with our scientists internally. There have been organizations that have talked about doing so, particularly on some of the main thoroughfares into the state. The question, TJ, that the dilemma that we face is not whether to set up sites of that nature or, in this case, work with private entities that wish to do so. TJ, the dilemma that I think about in that situation is where do we go from there? If we have a positive result, what advice do we give? And if we have a negative result, what does that mean? A couple of minutes ago, I chatted about how this Abbott test, the negative results leave some question marks. So if someone gets a negative result, are we willing to take that to the bank? So there's a logistics question that you correctly note about setting up the sites. but there's also these really difficult questions about what do we do after that? And as I think folks on these meetings have heard me talk about, before we move forward with the plan, I like to try to think it through as much down the decision tree as we can, so we don't just set something up and then get a bunch of results and say, oh boy, what are we going to do now? So right now in my head, TJ, what I'm thinking through is what do we do after the testing sites are set up, and what advice do we give people on how to behave accordingly depending on what that test result says. So,
Can I just follow up with that briefly?
Yes, sir.
We're finished.
No, not at all. Yes, sir. Go ahead, TJ.
If in fact you did set up the testing sites, would the discussion lead toward testing every vehicle or at random vehicles, or what approach would you take?
Well, two observations there, TJ. Again, the first is no final decisions have been made. The discussions are ongoing. The second observation is that the testing sites would be in concert with likely private entities. I don't know that it would necessarily be the state of Maine. It might be a partnership between the state and such private entities. Again, the conversations are still ongoing. And then finally, so yeah, there, that's kind of, it's under active discussion right now. So
excellent. Thank you.
Those are all the questions. I'd like to thank everyone for joining. Commissioner, was there anything final you wanted to chime in?
No, thank you so much.
Well, thank you all for joining us this afternoon. Thank you to Commissioner Makin for the work that she's been doing. Commissioner Makin and I have been working together on coronavirus issues as they relate to Maine's youth and children, not just education, but social and emotional well-being overall. I'd like to thank the Commissioner for her partnership, and we continue to look forward to working with everyone. Today's Friday, so I'm told, and so I wish everyone good health this weekend. As always, please be kind, take care of one another. We'll talk soon. Thank you all.